In the mid-90s, they were introduced as the answer to treating pain for hospitals and their patients.
There's a different set of medications that we could use that would probably be as effective and not give you the risk for an addiction to a narcotic. They pushed certain medications, I think, for physicians to prescribe, suggesting that they were safe, non-addictive, and some of that information may have not been correct.
Now in 2019, Dr. Jeffrey Visser says Tennesseans are still feeling the painful effects of an epidemic that, according to the CDC, has taken the lives of hundreds of thousands of people in the U.S. since 1999.
In my early career here, I never saw an opioid overdose unless it was accidental by an older adult who got their medicines mixed up, or someone who had a history of that type of illness or a psychiatric illness that was trying to harm themselves. Now we see it on people who really are kind of normal citizens.
New data from the CDC shows opioid-related deaths in the U.S. decreased by 3% from 2018 to 2019. But Tennessee saw a rise in deaths by nearly 10%.
We see a lot more severe overdoses, people coming in unconscious, difficulty breathing or not breathing that have had to be resuscitated by paramedics.
Visser, one of 2 medical directors at CHI Memorial, says the hospital is one of several across the nation working to lessen the number of deaths proactively through a program known as ALTO, which stands for Alternatives to Opioids.
There's a different set of medications that we could use that would probably be as effective and not give you the risk for an addiction to a narcotic.
The program is centered around using non-addictive medications like Tylenol and Advil for conditions with less severe pain.
But there are a lot of mild to moderate pain conditions, sprained ankles, people with pneumonia that have pleurisy, but don't necessarily need a narcotic for that.
And educating patients on the other pain prevention options that work just as effectively, according to research.
There's multiple studies that show that Tylenol and Advil alternating in combination work better for some fracture pain, sometimes kidney stone pain.
By saying no to narcotics and hello to Alto, they hope to find a new answer to treating pain. But in the meantime, they're working to decrease the number of ODs and deaths in Tennessee. Reporting in Chattanooga, I'm Joy Dukes, Channel 3 Eyewitness News.
Understanding opioid addiction and the stigma it creates is a vital step in the recovery process.